Introduction. Wellbutrin and Lexapro are prescription drugs that cause addiction and are used in the treatment of major depressive disorder. Both drugs act on neurotransmitters but have different mechanisms of action. Wellbutrin is a dopamine and norepinephrine reuptake inhibitor. Lexapro belongs to a large group of antidepressants, working as a serotonin reuptake inhibitor. Both drugs have a strong effect on the central nervous system and have a cancellation effect. CNS changes. Wellbutrin has a serious effect on the central nervous system and can negatively affect cognitive functions. Bupropion can adversely affect the ability to solve tasks that require clarity of consciousness, as well as motor activity. Therefore, patients taking Wellbutrin are not recommended to drive a car and work with complex devices. Lexapro also has a depressing effect on the central nervous system, interfering with the conception of attention. Given the effect of escitalopram on the central nervous system, it is not recommended to take it with centrally acting drugs. Routes of administration. Wellbutrin and Lexapro are available in several forms, depending on the indication for treatment. Wellbutrin is available in 75 mg and 100 mg tablets, and there is also an extended release form. Lexapro has two types of release form, tablets from 5 mg to 20 mg and a solution for oral administration. The dosage and form of release is selected individually, in accordance with the severity of the disease and the patient's lifestyle. Tolerance and its level. Escitalopram shows an almost complete lack of tolerance formation. However, in individual cases, it is possible to develop addiction and the need to gradually increase the dose. Bupropion, on the contrary, has a high risk of developing tolerance. It is often used in combination with other drugs. With the development of tolerance to Wellbutrin, a low dose of Lexapro may be recommended to achieve the same effectiveness. Withdrawal effects. Both drugs are capable of forming dependence on both the mental and physical levels. The cancellation effect of Wellbutrin can be manifested in excessive sweating, digestive problems, insomnia, and nightmares. Psychological symptoms include severe mood swings, depressive or manic episodes. The most common symptoms of Lexapro withdrawal are dizziness, chills, attentional problems, and uncontrollable crying. These unpleasant symptoms are quite common complaints among patients using both drugs. Individual brain chemistry and individual differences. Individual differences in the effect of drugs lies in the different mechanisms of action on brain chemistry. The most common reactions with the use of Lexapro were sleep disturbances, nausea, and increased fatigue. Such effects are caused by the effect that occurs when the dose of serotonin is increased. With extreme caution, the drug should be taken in patients with impaired renal function. Wellbutrin should be used with caution in elderly patients, and an increase in dopamine levels can cause problems with remembering information. Impact on behavior. Wellbutrin can cause uncontrollable fits of rage or anger. Some patients have reported symptoms such as behavioral changes, hostility, agitation, depression, and suicidal thoughts. Taking Wellbutrin can trigger a manic episode in a person with undiagnosed bipolar disorder. A person with an anxious type of depressive disorder may have an increased number of panic attacks. Lexapro may increase the risk of suicidal thoughts or behavior. An attention concept deficit patient may lose the ability to perform even daily tasks. A patient without comorbidities may experience an improvement in cognitive function associated with reducing depressive symptoms. Conclusion. Wellbutrin and Lexapro are effective drugs in the fight against depressive disorder. However, the drugs are addictive, which manifests itself in the sharp negative symptoms of the withdrawal syndrome. Individual reactions are determined by age and the presence of concomitant diseases. However, due to the depressant effect on the CNS, most patients experience temporary or long-term cognitive impairment. Both drugs should be taken with extreme caution under the strict guidance of the doctor. Everything you need for studies, essay samples, writing tools, and tips, you can find at studycorgi.com.